Good afternoon all. Today's my topic of presentation is epilepsy. My name is Prashant, Assistant Professor, Metro College of Nursing, Greater Noida. First of all, I would like to tell you what do you mean by epilepsy. Epilepsy is a very common condition in which it is characterized by recurring seizures. Epilepsy syndromes are classified by different and specific pattern of clinical features, family history and seizure type. Epilepsy is a syndrome of another underlying condition such as brain tumor. Absolutely, you have seen many kind of patients with epilepsy, and it is a very common thing after post-trauma or any kind of concussion or contusion inside the brain, or if any kind of brain tumor is there, so definitely the patient will have little bit of seizures. What will be the definition? Epilepsy is a recurrent seizure disorder characterized by abnormal electrical discharge from the brain, often in the cerebral cortex. You know as well, like epilepsy is a recurrent seizure. It comes, on regular basis and on recurrent basis. All right. So what will happen inside the brain? There will be an electric impulse which is discharged from the brain, and abnormally it is discharging continuously from the brain, often in the cerebral cortex, due to which epilepsy occurs. There are some more definitions of epilepsy, like epilepsy is a chronic seizures disorder with recurrent and unprovoked seizures. Next, epilepsy is a recurrent episodic disturbance of the brain function due to abnormal electric activity of the neuron. Likewise, I said to you, like there will be an abnormal electric activity from the neurons, due to which there will be disturbance in the brain function due to abnormal electric activity of the neuron. It is manifested by abnormal poor sensory. There will be a poor motor sensory and phenomenon in which will be the impaired or loss of consciousness will be there for the patients. Now comes for the epidemiology. The agent factors are exposure to toxins, for example, lead, infection, right, and any kind of neurological disease, injury, or any kind of concussion, contusion, trauma to the brain. Next comes the host factor. Most common onset of the epilepsy is before the age of 20 years. Have you seen, I think have you seen all the patients, many of the patients who underage like 20 and might be of 40 above patients. It is higher during the first year of the life and onset of the puberty. When the puberty is going to start, there will be a risk of epilepsy. Genetic factors will be there. Cerebrovascular accident will be there. If there is any kind of birth injuries, then it will lead to congenital seizures, brain tumors and abscess. Because of brain tumor and abscess, also will lead to epilepsy. Then comes environmental factors like air pollution, that is carbon monoxide and lead poisoning. I told you in the class as well. I had given an example, like due to any kind of air pollution, or if there is increase in the if there will be an increase in carbon monoxide, it will, and lead poisoning are the leading factors which can contribute to epilepsy. Some factors or events may precipitate the seizures, like any kind of factors, any kind of a shock due to which it will be precipitating. Unskilled handling of the time at birth causing brain injury and birth asphyxia. I told you that during the time of delivery of a baby, if it is not handled it is not handled carefully, or if there is any kind of birth injury, it will lead to epilepsy only, right? Then emotion disturbances will be there. Because of emotion disturbances, there will be an suddenly discharge of the electrical impulses, and there will be any kind of epilepsy in the patient. Next comes pathophysiology. As all you know, I told you previously, like there will be a disturbance of the brain functions due to any cause of genetic factors or any kind of injury to the brain, due to which the brain cells will become overactive and suddenly it will discharge, and it will discharge in such a manner so that it will insert or it will burst out an electric electric energy which spreads to different areas of the brain and may jump to the different areas of CNS, which cause seizures. What will be the clinical manifestations? Clinical manifestation, that is sign and symptoms of epilepsy. I think you all have seen the patient with the seizures. There will be a convulsion with the loss of consciousness, and the manifestation vary according to the part of brain involved. Actually, in brain, which part is involved, that will affect mostly. Like there will be classification for seizures related clinical manifestations. Alright, like first of all, it is divided into two parts. One is partial and one is generalized. This one is a partial and second one is a generalized. I tell you what do you mean by partial. When seizures appear to result from abnormal activity in just one part of the brain, like the partial seizure means partially means from the one part of the brain it will occur. In this and it under it partial seizure, it comes simple partial seizure. They have the elementary or symptoms and there is no loss of consciousness. In simple partial seizure, what will happen? There will be no loss of consciousness, and the patient may finger only a handshake or a mouth may jerk uncontrollably. He or she may talk unintentionally, may feel dizziness or experience unusual or unpleasant sights, sound, odor or taste. Means if a patient is experiencing any simple partial seizure, what will happen? There will be a loss of consciousness, and might be there will be no loss of consciousness will be there. Understood? Patient may have a feeling of shaky hands, shaky legs, shaky finger, etc. Now the seizures will be of this one. I told you the partial and complex, and the consciousness will be impaired in this. Second part comes the complex partial seizure. The patient consciousness is altered during this event. The seizures may begin with an aura. Patient may have no movement or moves automatically but inappropriately for the time and place, may experience excessive emotions of fear, anger and irritability. Patient, can find this kind of activity in complex partial seizure, like it will have an excessive emotion of fear, like excessive emotions comes out during this one. Alright, so in generalizing, next comes the generalized seizure, that is grand mal seizure. We can say it grand mal seizure. Grand mal seizures involve both the hemispheres of the brain. This is an intense rigidity in entire the body. Like you have seen the patient in the movies as well. You have seen like the patient will lying on the ground and the patient is rigid, means he is not able to, he won't be able to move his hands, his legs, and there will be a sudden discharge from the mouth, followed by an alternate of muscle relaxation and contraction. These are generally known as generalized tonic-clonic seizure as well. Like I'll give you an example. Like if you are seeing a patient with the seizures, so what we are going to do? Are we going to change the position of the patient? Are we going to move that patient? No, we don't have to move that patient. If we will move the patient, then definitely the patient is going to break his bones, because if the patient is extending his arm and we are trying to control it, definitely the brain is asking him to do these kind of things because there is an abnormal discharge, and if we are restricting it, then definitely it will break the bone. This one is the generalized tonic-clonic seizure. The phases of tonic-clonic seizure: the aura phase, the tonic phase, the clonic phase, and the postictal sleep. All right. In the tonic phase, simultaneously contraction of the diaphragm and chest muscle, which produce characteristics of epileptic cry. It means when the patient will be in a tonic phase, there will be a contraction of the diaphragm and the chest muscle. It will start to contract. Face will or may become pale, head turn into one side, eye fixed in one position, and hands are clenched like a fist. The hands will be like a fist. Loss of consciousness, tongue is bitten, frothy discharge from the mouth, ineffective breathing will be there, pulse becomes weak, irregular. This state may last for 30 seconds. Just note down this point, in tonic phase only. Alright. Then comes the clonic phase. In clonic phase, it will, like I told you in the tonic phase, it will be only for the 30 seconds or something. But in clonic phase, there will be a jerky movement, last for 1 to 2 minutes, incontinence of urine, because there will be no, there will be no hold of the muscles, or there will be no hold on the urinary bladder, or there will be no hold on the sphincters, due to which there will be incontinence of urine, or stool can pass out. The patient will pass out the stool as well during the clonic phase. The patient relaxes after jerky movements and goes into a deep sleep, coma, breathing will be noisy. This state lasts for 1 to 2 minutes. Postictal state. After the seizure, the patient are more often confused and hard to arouse and may sleep for hours. Many complain of headache, muscle ache, fatigue and depression. I'll give you an example. Like I had seen a patient once upon a time. So he was actually walking through the road, and I was sitting over there, and he just suddenly he just fell down. And he was unconscious. He was in this one tonic and clonic phase, due to which he was clenching his hand, and the watery substance was coming out from the mouth. And as a nurse, what we are going to, as a medical professional, what we are going to do, we have to insert a hard material so that he can't bite his tongue. And afterwards, it was a time period of 1 to 2 minutes, and afterwards when the patient woke up, so we tried to ask him what happened to you. Then he told me, first of all, for at least 1 minute he was not able to recognize himself. Who was he? What happened to him? He was in a complete semi-conscious stage. Afterward, he told me that he was suffering from post-surgical epilepsy. Means before 2 or 3 months he undergone through a brain surgery, and afterwards this happened. So we are going to check the assessment, how we are going to assess the patient, and how we are going to diagnose the method. History of event during the pregnancy in the child, birth for example, difficult labor, trauma or birth asphyxia. We have to ask if the patient is under 20 or any age group, we have to ask the attendants that, like, what happened to him, is there is any kind of congenital abnormality, or any kind of birth asphyxia, or there will be was there any kind of trauma or difficult labor due to which this happened. Second one is the neurological examination. We have to do the neurological examination for the patient. MRI is to be done for the lesions or any kind of abscess or the tumor. If the patient is having any kind of abscess, if the patient is any kind of tumor, then we have to ask the patient to go for the MRI or CT scan. Alright, blood test we have to take. What will be the prevention? So it will be two types of prevention. One is primary prevention and one is secondary prevention. The use of safety precaution to prevent, first of all, the primary prevention, use of safety precaution to prevent injury during the birth, early detection of high risk mothers to prevent complication during the time of pregnancy. While if a patient or if a pregnant mother will be there, so the staff has to see that there should be no any kind of complication during the pregnancy. Otherwise, it will lead to epilepsy or something if it is a congenital abnormality. Then, essential obstetrical care, institutional delivery to provide the basic emergency obstetrical care and basic newborn resuscitation services. Likewise, we have to means all the staff members should be given an institutional delivery to provide a basic emergency obstetric care and basic newborn resuscitation services. Skilled attendance at birth with appropriate referral, service of complicated cases. Then use of safety precautions to prevent the injury during the birth. Early detection should be done. As I told you, early detection should be done. Then secondary prevention. It includes early detection of treatment of the cases. In the secondary prevention, medical management includes need of long-term and immediate treatment of epileptic drugs medication. The treatment in a single drug therapy, like we can give the patient a lorazepam, like 2 ml we have to give during the time. If suddenly it happens in the hospital, we give IV lorazepam. Airway and oxygen administration IV line is established to give the medication. diazepam, lorazepam, as I told you, administer slowly in attempt. Now, what will be the surgical management? It is indicated in the following condition, like anatomical lesion, for example, brain tumor or hematoma or abscess will be there. So, surgically we have to remove that, and then this problem might be resolved. Next, tertiary prevention. It aims at rehabilitation and preventing complication and disabilities. Vocational rehabilitation should be done of the patient through proper training and education. Some suitable vocation means we have to give the education to a patient that how we have to do, how we have to take care of ourselves during this kind of period. It enhances the patient's self-esteem, self-confidence, and reduces fear and security. If you will maintain an IPR, if you will teach the patient well, then the patient's self-esteem, self-confidence will be increased. Their parents, their family must be provided to relieve the anxiety and the fear. Right? So, saving the world one seizure at a time. What should be the nurse's role? To protect from injury by removal of sharp objects, prevent patient from fall by providing side rails, which should be padded, remove pillow or ease the patient to the floor if possible. If the patient is on the bed, try to keep the patient on the bed and sideline position should be provided. Remove secretion by suctioning to prevent the asphyxia to keep the airway clean. Turn the patient to sideline position to help in draining pharyngeal secretion. Never leave the patient alone, because patient can have any kind, he can self-harm to himself. The patient should not be restrained during the seizure attack, as I told you previously. Do not insert anything in patient's mouth. If you want to insert, kindly insert the hard substance like spoon, not a pen, not a finger, otherwise the finger will be bitten by the person. Close observation should be kept on the conscious level and note fluctuations in mood and attitude. Administer oxygen as advised by the physician. Loosen the patient clothing from around his neck. After the seizure, put the patient on one side to prevent the aspiration. Health teaching should be given to the patient, as I told you, to continue the medication as advised by the physician. Care during the convulsion to prevent the injury. Tongue bite and not restraining. Proper nutrition to prevent the malnutrition. Should avoid stigma. Remove stigma attached to the condition. Should carry any emergency medical identification card or wear an identification bracelet. Counseling of patient and family should be done regarding this type of nature of epilepsy. Instruct the patient to avoid excessive stimulants such as bright light by wearing dark glasses or covering the eye from glare and hand if nothing is available. Emphasize regular follow-up. This one is the cheat code like we used to play in the game, like first attempt in blank staring, chewing, fumbling, wandering, shaken, confused. This one is the common symptom. Second comes the follow first aid step. Do not grab or hold the patient. Explain to others she is having a seizure. Block the hazards. Don't let anyone come near the patient. And speak calmly that you will be okay. Track the time nearby if you are tracking time, that how much time the patient is suffering from seizure, and then the patient automatically will be fine. All right. These are the references. If any kind of query is there, kindly ask me. Thank you and have a nice day.